In the past 10 years, many industries have seen incredible growth. Clean tech, venture capital, technology, for-profit universities, mobile payments, even hot sauce production. So why did this happen? Probably because these companies were willing to take a chance, to make a change, to venture out and not accept the status quo. 10 years ago, we used paper and pen to complete case report forms. Today, we use the web and the cloud. 10 years ago, sites submitted IRB documents via the mail. Today, we upload to portals. 10 years ago, sites opened envelopes to randomize subjects. Today, we do it through the web.
But why haven't these changes resulted in growth for the sites? What is in the way of the site's growth?
I think certainly there's an opportunity at an investigative site level to collaborate with their peers. If there was some type of ability or forum for them to gather their thoughts, to advance issues, to identify potential unique opportunities that could really further that sponsor-site relationship, being able to give the site a voice and a true voice across a diversity of sites, I think is absolutely essential.
Well, that's been one of the largest challenges sites have faced in general, is they don't have a unified voice. And that's so critical, right? We're looking at such a fragmented environment today with nearly 10,000 unique locations where trials are conducted, nearly 30,000 principal investigators conducting at least one 1572 registered clinical trial. It's a very, very fragmented community, and it needs a unified voice. It needs to have a backbone that is pushing it to move in a unified direction. And I think sites really need to find a home where they can make that happen.
Right now there are lots of initiatives where sponsors and CROs are coming together to talk about site quality. Sites aren't there. And I think whatever results from those conversations needs to be informed by the perspective of sites. Sites know a lot about quality, and in fact, it's the quality of the site, of the conduct of the research that everybody's interested in. The folks that are closest to the ground have a lot to say about that, and I think should be in that conversation.
Let's face it, who among us couldn't agree that clinical research sites don't have a voice? I think we all agree with Ken, Peter, and Doug. So where do we go from here? What do we have to do to create that voice for clinical research sites? First of all, we need to advocate. We need to advocate on behalf of clinical research sites to the rest of the clinical research industry, to the other stakeholders. We have to connect with each other and with those same stakeholders. We have to educate each other and again those stakeholders. We need to understand and respect each other's position. And lastly, we have to mentor. We have to mentor not only each other, but we also have an obligation to mentor the new clinical research sites that continue to come into our industry each and every day. For the last 7 years, we've been coming together at the Site Solution Summit. First as sites, and then with sponsors and CROs and other stakeholders joining us, and we have had phenomenal dialogue over these last 7 years. But let's face it, it's time to move beyond an annual meeting. It's time now for the Society for Clinical Research Sites to be unveiled to you, the first trade association representing the global clinical research sites community. And through your membership, and through you joining the Society for Clinical Research Sites, the clinical research site community gets a voice.
Now's the time. I'm ready to join SCRS.
I want an organization that communicates my perspective to industry stakeholders. So I'm joining SCRS.
Together, our voices can be stronger. I'm joining SCRS.